All right, Code of Ethics for 3 Mountain Regional Hospital by Amanda Inman. First code of ethic is patient relations. As a patient, you have the right to access treatment regardless of race, sex, religion, veteran status, or source of payment. Notify the hospital staff of a living will for the medical staff to follow it. You have the right of knowledge of which physician that is primarily responsible for your care. Accept or refuse any form of treatment. Patient be informed of treatment and choice of language they can understand. Voice any concerns or complaints, and participate in your care plans and ask any questions. As for the physician activities, their right is to build trust relationships with their patients. They are responsible to provide helpful information to the patient to fully understand their medical condition and their option of treatment. Physicians should respect and care of the patient's medical information and keep everything under confidentiality, and be respectful of the patient's goals, values, decisions, and preferences. Moving on to the third code of ethic is billing for services. Here's the process to obtain reimbursement for services. Each health insurance is different, but each carrier has their own outline on what the patient pays. The patient is financially responsible for their services. If the patient does not have health insurance, then they are responsible for payment. All healthcare plans require the patient to pay some sort of portion of their services, this is the deductible, and each service is coded and billed for. Moving on. No staff can express their political views. Always be professional, and they cannot influence patients' or families' political viewpoint. All right, conflict of interest. This is the code of ethics to help protect our clinical research. Our investigators are to protect our design and our conduct of our clinical research. Conflict of interest, the code is for patient safety, safety of reporting clinical research. Our staff is to be required to complete online research for this conflict of interest training, and each individual is required to disclose any information they find regarding the conflict of interest. The sixth code of ethics, communication, including social media. Employees should understand that they are the face of 3 Mountains Regional Hospital. Their actions, both good and bad, reference our company. Employees should always use their best judgment at all times, and social media is discouraged while clocked in. All employees need to get appropriate permission before you refer to posting anything work-related on any types of social media. And 3 Mountains Regional Hospital computers are only used for business purposes only. Policy, privacy, and consent. Have the right to get a copy of our policy notice. Request confidential communication from a medical professional taking care of you. Tell us your preference on what and who to share your medical information with. This is known person you do not wish for us to share information, then please contact a nurse ASAP. And you have the right to file a complaint with the U.S. Department of Health and Human Services Office for Civil Rights. There's the contact number if you feel like your privacy has been violated. Patient medical records. Every patient has the right to their record. We never share your chart unless given us written permission. We have 30 days to obtain your request to give you or another medical office your chart. Every patient has the right to their own medical record. Patients have the right to get a list of those who have seen their medical record at our hospital. They have the right to choose someone to act for them, which is considered a living will. And they do have the right to file a complaint if you believe your privacy rights have been violated. And we can share your chart only for billing and payment purposes, such as sharing with insurance companies to gain payment for services provided by our hospital. Patient safety. Patient safety is our number one priority. Always promote safe care and continue looking ways to improve it. Always check ID bands before giving medication or doing a procedure. We have an infection prevention program in place. We know germs are everywhere, so let's work together to stop the spread of them. Employees should always wash their hands throughout the shift. Hand washing is the number one way to stop spread the germs. If the patient is a fall risk, that needs to be noted on the outside of the door and staff needs to check on regularly. Last but not least, our non-discrimination policy. Our hospital complies with federal civil rights, and we do not discriminate or exclude people based on race, color, age, sex, or disability. And we provide free language services for people with disabilities, such as sign language, qualified interpreters, also information regarding other languages so the patient is able to truly understand. All right, thank you so much.